I'm Rajesh Midha from Bottle Rocket, and I'm here with ClearBalance Healthcare CEO Bruce Haupt. We have a tremendously exciting discussion coming up. In the next 15 to 20 minutes, we're going to be talking about pain points that exist in healthcare, how important it is to provide transparency around pricing, clarity around the service offering, things to be thinking about as we navigate the patient journey. If you work in healthcare in a health system, for any sort of payer, for any sort of operator, for any sort of business person related to healthcare, this is going to be a really exciting discussion for you. So before I ask my colleague Bruce to introduce himself, let me take a moment and tell you a little bit about Bottle Rocket. Bottle Rocket is an experience consultancy. We are experts at building the front level digital experience that patients and customers see on top of all sorts of different backends, including platforms like EHRs, as well as other third-party systems that exist. Our goal is to help patients to have the best possible experience within the healthcare setting and try to shift healthcare from being reactive to proactive. Bruce, why don't you take a minute, introduce yourself? We're thrilled you're here. Thank you.
Great, Rajesh. Thank you very much. Really appreciate being here. Excited to talk about these things. As was noted, I'm President and CEO of ClearBalance Healthcare, and we focus really 100% on helping healthcare systems and providers offer their patients a way to cost effectively pay for their portion of the services. And we do that through patient financing. We do it in a very friendly manner, first of all. Usually no credit checks, no fees, anything like that. So it's something very important for most of our providers who want to make sure they create a tremendous patient experience. And we're here to talk about all the other things that they can do to make a great patient experience. And there are many ways, and we'll go through that as we go in today, how something like patient financing can fit within a really consumer-oriented digital experience, something that I know that you all really help these healthcare organizations do. So let's jump into it.
Okay, awesome, Bruce. Okay, so let's begin with some of the pain points that exist in the healthcare system from a patient's point of view. And when we think about those pain points, one of the frameworks that I like to use is this idea of awareness through to the consideration experience, through to becoming a patient within a health system, through to what is that experience like, and how do we as healthcare providers help that patient to have a great experience so they become advocates for our brand. Can you speak a little bit, Bruce, around some of the pain points that you see for patients as they navigate healthcare?
Absolutely, and you said it very well. The journey from this idea of awareness all the way through to I've had this service and I'm going to follow up, and I want to make sure that I'm healthy, I'm done, and I'm done with the service. But generally, the customers we work with are large health systems. They're complex health systems. They have many settings of care, and so being done isn't being done. They'd like you to come back, and so we want to make sure that whole experience, excuse me, is a good one. Now, the thing that we focus on, obviously, is the financial side. And so what is very important is that when we start that journey of awareness, that individuals, consumers, can understand not only what they're investigating around the clinical side, but what's that going to cost? For me, if I have insurance or a high deductible plan, I need to know what it's going to cost. And if I can know that, then what are my options to pay? If you're the provider, you would want the patient to know because you'd like to be pretty sure that you are going to be able to get paid or how you're going to get paid. So I see that as the number, and that carries on through that whole journey because I'm trying to make a decision. Do I know what it's going to cost? If somebody can tell me, no, this procedure is going to cost you $2,500, but you can have it for $100 a month, well, that might go into my decision if some other option down the street is $2,000, but I don't have $2,000. So it starts up front, and we'll talk more, but it can continue on through that journey because just learning about it is just step one in the process.
Yeah, no, I think that's a terrific point, which is that I think historically we've often thought that financial decisions and financial consideration is kind of that end step, which is, of course,
Right.
how do we get the payment for the services rendered? And we know that there's a lot of money as healthcare operators. We know there's a lot of money locked up in that payment. There's a lot of costs associated with following up with patients around billing and healthcare partners around making sure that they're paid from the insurance company. But I think what you're bringing up here is how it's possible to really shift by bringing that financial consideration piece all the way to the upfront part of the patient journey, that top of the funnel, right? Right at the same time I'm evaluating my clinical decisions, I need to also be thinking through my financial side. How affordable is this? How am I going to make these payments? What am I entitled to as being part of insurance? And what is this going to cost me out of pocket? And so I think you're right on point. Perhaps, Bruce, I could ask you, if we were to take the model of kind of a now, near, and far, what do you think that health systems should be considering right now as they think about reinventing that patient journey?
Well, as you know, that's a great question. As you know, price transparency is now a thing. I mean, health systems, obviously, if it's not emergency, if it's planned, there's a number of procedures where you're obligated to tell the person, what is this going to cost? But again, that's a price for your service. It's not the cost to me based on my individual situation. So I think the now that folks need to do is, first of all, they need to get that right? They have to be able to tell people what it's going to cost, and then tell them what it's going to cost for them. And again, the now in my mind is ideally that would be before I've even made the decision to do this. I want it because there's enough shopping going on. You want to do that. But if it's at the point of service, I want to be able to tell them what it's going to cost for me. And then the second piece is providing individuals options to pay for that, because we know that many of these procedures that people engage with are going to cost anywhere from $2,000 to $5,000, and we know that the high deductible health plans that a majority of people have in the United States have deductibles on the order of $2,000 to $6,000 for an individual, and twice that for a family. So being able to articulate that and provide them those options, and they should have multiple options. People like choice, and they feel like they're in control if they have choice. So I would say that's the now. As they think about the future, you think about marketing yourself, and you think about talking. We do knee replacements really well, and it's $250 a month. That's what the car dealer tells you about buying that car, right? And that's a whole different mentality. But that's a future. But I think it is certainly something to work with. And then I think the other interesting thing that I know you all can help with is like, well, how do you tell those patients? How are you getting this information to them? How are they engaging with you to understand that? So those would be my thoughts to get us started anyway.
Yeah, no, I think that's right. If we draft off that idea that there's a clinical decision that I'm making, I'm selecting some sort of service in partnership with my healthcare provider, my PCP or my specialist, and then I'm also trying to work out these financial considerations. How as a health system operator, putting the health system operator cap on, hello, health system operator here. How am I helping that patient to have clarity around the clinical side and an understanding of the financial considerations and options? And I liked what you talked about in regards to that future state. We see a lot of innovative models of buy now, pay later in so many other markets. But in healthcare, it's still really tough. And so many health systems we're talking to right now are really trying to expand their footprint and grow and add more patients to their health system, and providing a way to help people through that price transparency, choice, also the payment options once they've selected something. And then, of course, the clinical side of thing, I think health systems do that very well, but more clarity is always better than less. Do you think, Bruce, that there are things going on now with COVID and this move to virtual that are going to also be needing to be thought about from a health system and patient engagement standpoint as we move forward?
That's, as they say, the new normal is going to be new, and we don't always know what that normal is going to be. But one thing that we have seen, I know I've seen it, you all have probably seen it as well, but this move to creating a more digital, virtual, online environment has been greatly accelerated. Certainly, from a check-in standpoint, hospitals, health systems, doctors' offices, they don't want people waiting around in their office to wait for the practitioner or sitting there filling out paperwork. People want to be able to do that online, on their phone, take care of those things. I know my dentist, my doctor, I got an appointment, I get a text and it says, oh, fill out this information. First information is basically, do you have COVID? But the second set of information might be anything else that they need from me. And so, I find that's a key start right there. So you're trying to take care as much of as you can online and pre-service, and then give the individual the opportunity to self-service as much as possible, because we're just trying to minimize the necessity for long-term face-to-face interactions. And I just don't see that changing post-COVID. People will want to, people do like interaction. I like interaction. They're going to want to have some, but this is going to be the new normal, in my opinion. I mean, what do you all see with your customers as you look across the marketplace?
Yeah, I mean, I think a lot of the customers we serve on the health system side are really thinking about it through this idea of grow, engage, and retain their customer base.
Mm-hmm.
And one of the things that we're helping a lot of people do is deploy these world-class digital front doors. So think about this as a digital experience for patients that's available, through a mobile app or through a website. And that digital front door being the primary way that patients are engaging with the health system, especially during COVID. And that includes, things related to a payment, things related to scheduling a virtual appointment, things related to like on-demand care, even these like e-consults where, you're like, should I be going to an ER? Should I not be going to an ER? Well, it would be great if I could open my app and, chat with a nurse practitioner and really, get some help here in terms of my decision making. So that's one set that we're looking at. And then we've also been doing a little bit of research on the side of the patient journeys themselves. And, why I think this conversation is so interesting is that on all these patient journeys, there is always a thread around peace of mind and helping patients to have peace around the clinical decisions that they're making, but also their financial decisions. And there's always a high risk from the research on cost. Cost is really a barrier to engagement. And so that's why I think that a lot of the work that ClearBalance Healthcare is doing here is really compelling, especially as health systems think through how to drive patient engagement. So I definitely think COVID is going to have a long-lasting impact. I think we're going to see more virtual, more engagement through these digital tools. And I think that the good news is that there is a way to have that relationship with a patient or customer between visits, and to do that, cost effectively in a low touch way, in an asynchronous way that patients are used to, frankly, with other, social media sites, other consumer companies. And now we're bringing that to healthcare, which is really, really compelling. So, Bruce, as we move forward, what are some takeaways that you would give to anyone watching or listening to this, like as they think about growth in this area?
So, and somewhat selfishly, but I do believe that it's very important that as organizations think about your grow, engage, retain, which I think makes a lot of sense, that they need to marry the clinical and the financial together, the experience for the patient. I see just too often that either the revenue cycle team's off doing their thing, the clinical team's off doing their thing, and the patient says, wait a minute, I get the service and I got to pay for the service. This is me, right? So I think that's, putting it together and not only, tactically or present, but strategically. Think about how you want to present your organization and your services, and you're billing yourself as, hey, we got the best quality for this, for that, but we're also affordable. Back to your peace of mind. I mean, there's actually studies proven that if people are anxious and concerned about certain things, their healing process is not as good. So if you can relieve that financial stress right up front, just as at the same time you're relieving the clinical stress, people are worried about the procedure, is this, am I going to get through it? What is it? That to me is really important. And that would be my biggest thing. And think about that strategically. How are you going to promote yourselves both clinically and financially, and the options that you provide patients, and then deliver them that experience, because we do all expect to do it right here on our phone. Oh, you can't see my phone, but it's on my phone.
Yeah, no, terrific. Bruce, this has been an awesome conversation. Thank you so much for your time today. I'm thrilled you're here, and definitely there's chapter 2 in our future. So thank you very much, and we'll talk again.
Well, thank you, Rajesh. Great talking with you.